Hi, I'm Dr. Michael Gartner, double board certified plastic surgeon. Ever wonder how drugs are metabolized in your system? Well, stay tuned and check this video out because we're going to go through it.
Drug metabolism is the chemical conversion of drugs into water-soluble compounds that can be excreted by the body. Drug metabolism mainly takes place in the liver, while excretion mainly takes place in the kidneys.
When you swallow something, a lot of these drugs are what they call lipophilic, which means they dissolve very easily in fats and oils. And so the body metabolizes them in the liver, and they convert them to a product called hydrophilic, which means then it dissolves easily in water. Then transferred to that system, it gets excreted by the kidneys because the kidneys can extract that.
Following drug administration, drugs must pass through tightly packed cells, crossing cell membranes to reach their sites of action.
So this outer layer here, where those balls are, those are lipophilic. So that's where the fatty part of the drugs kind of pass through, and then it gets converted into the liver.
Usually drugs are lipophilic or fat-soluble compounds, and cell membranes are composed of phospholipids, so drugs are able to cross them.
Phospholipids form the primary structure of the cells on the outside, the cell membranes.
However, for excretion by the kidneys, it's necessary to convert drugs to water-soluble or hydrophilic compounds.
Because your kidney doesn't excrete fat, it mostly excretes urine, which is mostly water, so it has to be converted.
Drugs are usually administered orally or parenterally. Parenteral drugs bypass the digestive tract.
So parenteral is any other way usually besides orally.
Parenteral routes include injection, transdermal patches, lotions, inhalants, and suppositories.
So these usually pass into the body quicker, with the exception of maybe transdermal patches. So obviously IV injections, medicine gets directly into your system. Orally, it has to go through your stomach, get digested a little bit in the stomach, then go to the liver, and then gets distributed out.
The liver has a chance to metabolize some of the drug before it goes into general circulation. This is called the first pass effect.
So the hepatic portal vein is kind of an interesting thing. It's portal from the intestine into the liver. It's a vein because the oxygen has already been removed. It's very nutrient-filled material without oxygen. And then those nutrients get metabolized in the liver. And this first pass effect, it has less bioavailability than IV routes or other parenteral routes.
Drugs enter hepatic cells, where a series of enzymes in smooth endoplasmic reticulum metabolize them.
Smooth endoplasmic reticulum, they kind of have a key role in metabolism and also a function of the cell. They are really important for overall health of the cell as well.
Drugs move through the phospholipid membrane of endoplasmic reticulum. Hepatic microsomal enzymes, such as P450, convert drugs from lipophilic to hydrophilic compounds.
And this is mostly done by this P450 system, which is very efficient at doing that.
Repeated use of certain drugs increases the amount of metabolic enzymes and increases drug metabolism. This is called enzyme induction.
When you use a certain thing in the body, like a drug, keep on going, and your body builds enzymes and it refines its machinery to metabolize that particular drug quicker.
Conversely, certain drugs compete to bind to metabolic enzymes, thereby decreasing drug metabolism. This is called enzyme inhibition.
The opposite happens when you don't use these particular medications too often.
A drug's duration and intensity of effect are largely determined by metabolic rate. Increased metabolic rate will decrease drug duration and intensity by facilitating excretion.
If metabolic rate is high, you metabolize drugs a lot and you need more drugs concentration to get the same effect.
Decreased metabolic rate increases drug duration and intensity.
If you have liver damage, for example, or your liver's sick or cirrhosis for whatever reason, you have to be careful not to put a lot of high concentration medications in there because it's going to take forever for them to get metabolized. And also the same thing with the kidney. If your kidneys aren't working right, it's going to take a longer time for that drug to be excreted in the urine.
A few of the factors affecting metabolic rate are the first pass effect, liver disease such as cirrhosis. Neonates and the elderly have decreased liver function. Compromised blood flow to the liver will lower metabolic rate. Variation in amount and type of hepatic enzymes, poor diet and nutrition can affect normal liver function, and higher circulating drug levels due to dosage or patient's weight take longer to metabolize.
A few other things they don't mention is temperature can have an influence on metabolic rate. Also, infection or illness can increase the rate significantly, especially if you have cancer or something like that. Exercise can increase the metabolic rate by increasing muscle mass, which is going to increase the metabolic rate. And also, something called growth factor stimulation can increase it. That's how molecules talk to each other through signals, can affect the metabolic rate. And so that is basically how drugs get metabolized. So if you're interested in these kind of videos, subscribe, give us a like, and you'll see more on the way.